Dr. Bregman. How are we doing today?
Good. I'm here in sunny Florida with a nice background.
Yeah, it looks more like Tahiti to me.
Me too. I think I'd like to be on that beach down there.
I know. Well, today we have a patient question, but the patient is really a friend of mine, which we will change her name to protect her identity. And the question is mine. We've been talking about OCD this week. And you know, OCD is a term that a lot of times, if someone's very fastidious, if I'm fastidious, I like my room just so, and I'm always getting very picky, you go, oh, I've got OCD. You know, we use it quite casually. But I have a friend that I believe has OCD. She's been suffering from it forever and ever. We'll call her Cindy. And her deal is whenever she goes out of the house, it takes forever. She unplugs everything because she's afraid the house is going to suddenly erupt in fire. If we go to lunch or dinner, after we pay the bill, we're about to leave the table. She's underneath the table looking to see if her purse had dropped something, you know, and you know, it hasn't. And so there's this kind of this quasi paranoia about something happening, her losing control. And I've known her for a long time, and it seems to be getting worse. My question is, does it sound like she really has obsessive compulsive disorder? And if so, how do I broach this problem with her so that she'll get some help?
Okay, you know, Linda, this is a question I get very often, you know, from patients, friends, families. When do they come to see me is also the question. What happens here is, and this is a little bit of a psychiatry, okay? So we see problems as egosyntonic, meaning they're like part of us, or dystonic, that means they're a little distant from us, and then maybe we would want to get some help for it. Like, for instance, with this friend, okay? Like, what happens if you told her, look, you know, last time we went out, and this has been happening a lot, you were under the table looking for something you didn't need to look at. I looked with you and nothing was there. Everybody was looking. It was very shameful, I'm sure, for you, and embarrassing. And then your friend may say, you know, you're right. And I think I better get some help because it's getting in the way. People are beginning to wonder about me. So it comes from it becoming something that bothers the person, because there are people that have these behaviors. It doesn't bother them. They don't mind going under the table. They don't mind spending an hour to get out of the house, and then they never get any help. But when it bothers them, then they want to get some help. And I see that's where I really see, and people come to see me. And you know, sometimes your friend could go with you to the doctor, you know, to help them, have a companion to go with them and help them. And if you've also known the doctor, or you met the doctor, or heard about the doctor, and help the person, tell them it won't be a shameful experience.
So I was reading before I talked to you that this problem actually gets worse with age, and that if you let it go, it becomes a huge disabling problem. Is that true?
Absolutely. You know, well, usually with any problem, the idea of something being acute is what we want to treat. The minute things go on for longer and longer time, then they become more ingrained patterns, and the behaviors and things become ingrained. So we would like people to go and get some help quicker. Now, really, one of the things that I'm concerned about is that when we have really decompensation of individuals with this disorder, they really can become psychotic. And that's when I see them also in the hospital. So in other words, it's like they go from functioning people to psychotic people. So we have to really be aware, and if we see people doing it more and more and becoming more dysfunctional, we really have to help them get some help before they wind up psychotic.
So speaking of help, I'm playing devil's advocate here. What if she says, oh, I don't, that the treatment that she doesn't even know about yet scares her? How do I convince her that it's incredibly effective? I mean, tell me about that. That it's not exactly simple, but it's very effective and it can be cured, can it?
Well, honestly, this is one of the disorders that I've had the most satisfaction in my long career in helping people. That really the combination of management, medication with therapy is fantastic. And when I started out, it was a labor to deal with patients. They didn't get better. Now we have excellent success rates, and the medications are without side effects a lot of times and really effective. I mean, it's an amazing turnaround. So I think you could tell your friend maybe that you've been reading up and learning that this is really a treatable thing, and she really needs to get help, and you want to go with her. You'll help her make the appointment.
Okay, I will do, and I am so grateful for this information. It gives me hope to give my friend hope. Thank you so much.
You're welcome. That was really, I think you should definitely get your friend some help.
Absolutely. What are friends for?
Okay. Exactly. Bye-bye now.
Bye-bye.
Bye.
BregmanMD Medical Group offers online psychiatry and online therapy.